Welcome to Shalamar Surgical Intern Training Program led by Dr. Khaja Azim, Head of Department Surgery. This is your basic orientation program, and every question that clogs your mind will be answered here, so stay tuned. We will talk through what an internship is, what is expected of you as an intern, the roadmap of Shalamar Internship Training Program, and a lot more. An internship is a program offered by an employer that provides potential employees with work experience. They are typically targeted towards students who work between 1 and 4 months at their chosen hospital to gain practical on-the-job or research experience. You may have a medical degree, but you do not have the full license to practice medicine unsupervised. To be a successful intern, you need to be reliable, you should bring energy and enthusiasm to the table, you should dress well, you should balance self-sufficiency with asking questions, participate, stay flexible, and pay attention to detail. What should make you choose Shalamar? Over the last 44 years, Shalamar Hospital has evolved into a tertiary care medical facility with over 500 beds and 25 clinical departments and specialties equipped with world-class diagnostic and treatment facilities. We aim to drive forward the strategic partnership between all complementary units to develop and enhance intellectual rigor, practical clinical skills required to work in diverse settings, and instill a deep commitment to patient welfare. We take pride in our Department of Surgery, which was established in 1974. Our surgeons are leaders in their respective disciplines, including endocrine, colon, rectal, thyroid, and bariatric surgery, with particular expertise in performing minimally invasive surgeries. We have separate male-female surgical wards and private rooms for patients where they are cared for and managed pre- and post-operatively. We have fully equipped operation theaters which are 24 hours functional. What do you as an intern need to know about our training program? We offer a 12-week internship program where you work side by side with experienced perioperative personnel. Our goal is to ensure a safe and satisfying experience for our patients with top quality outcomes. You will experience pre, intra, and post-operative care in a technologically advanced teaching hospital. You will also establish an excellent foundation for your career. This will help you better understand perioperative care, focusing on the entire perioperative process. During your 12-week internship at our department, you'll gain basic knowledge about trauma, bariatric, and breast surgery. You will participate in providing quality direct and indirect patient care under the direction of designated healthcare professionals and surgeons inside the operating room and beyond. You will be assigned opportunity with designated surgeons to demonstrate an awareness of the diagnostic and treatment plan for patients. An orientation to the operating room will be provided. After your orientation, you will be handed over with responsibilities to participate in clinical care, round on patients with surgeons, and participate during office hours. Your job as an intern is to treat the patients under appropriate supervision. You have to ensure that your functions are carried in a good manner and more priority is given for patient safety. You are expected to participate as a member of the multidisciplinary team in the hospital to take care of patients. You are expected to order and interpret diagnostic tests and initiate and monitor the treatments given to the patients. Communication with patients and their relatives is essential. You are the ones who take responsibility for communicating with them and other hospital clients. You have to cooperate with investigations, audit or inquiries that are related to the provision of health. You are expected to take a daily round through all the patients for their regular checkup and assistance regarding any health issue. As an intern, you'll have all of the experiences that a resident would have, but without as much responsibility. You won't be expected to make major decisions, but you will more than likely get to watch how others make those decisions. This will help you be prepared for an upcoming job where mistakes are not easily forgiven. As an intern at our department, you need to cover certain milestones during the 3 months that you'll spend with us. You need to have a thorough knowledge on how to record a detailed clinical history and perform a systematic physical examination and identify abnormal findings. You need to have a knowledge on how to evaluate pre-operative patients with basic surgical issues. You need to know how to maintain asepsis in operation theaters, manage ward and post-op patients, manage acute abdomen. You should be able to perform basic surgical procedures like venipuncture for phlebotomy, upper limb peripheral intravenous cannulation, blood cultures from peripheral sites using sterile technique and male urethral catheterization. You should know basic suturing skills, the primary closure of minor lacerations, understand the guidelines for use of blood and blood products, prioritize clinical responsibilities, plan discharge, and complete research project. Finally, at the end of your rotation, you will be assessed through 3 fundamental elements: your clinical judgment, communication, and professional development. Our head of department's feedback and written evaluation is then handed over to you upon your successful completion of the rotation. We have different modes of assessment. An assessment form must be completed by your trainer and signed by you. We have our e-learning network where you'll have modules. These modules will include interactive compulsory stations. These include demonstrating clinical understanding of prescribing as well as case vignettes. You will record clinical procedures in your e-logbook. You will also be assessed on bedside and your interaction with patient will be observed. At the end of your rotation and completion of all the requirements, you'll be handed over our certificate of experience. This was your basic orientation program and everything that you need to know before stepping into our internship training. In case of any queries or unanswered question, feel free to contact us and we will get back to you. Thank you.